And with us also is Angela Halpern. She is also a speech therapist with LSVT Global, and she's in charge of facilitating the national and international training and certification courses for LSVT Loud and LSVT Big. So she assists the team in research and development of new courses and products, and has worked to develop an advanced Loud for Life exercise maintenance classes for LSVT Loud graduates. Because yes, once you do it, you still have to continue to practice it. So I know they'll talk about that. So we're very excited, ladies, to have you join us. Welcome, welcome. And I would like to hear from you directly, like, how did you get into this? What drew you to this particular part of speech therapy? And then we'll let you get started with your presentation.
Sure, I'll take first pass and then toss it over to Angela there. So welcome everybody, it's wonderful to be here, and thank you to PMD Alliance for supporting so much online programming and including us in that. I got involved in this work, actually I finished my master's degree back in 1994 and worked with Dr. Ramig. She was one of my professors at the University of Colorado Boulder. And my first job in speech therapy was to move to Tucson, Arizona. And we were doing a satellite research project off her grants at the University of Arizona. So my very first job was doing nothing but research with LSVT Loud. And I would recruit subjects into the study. Dr. Ramig would fly in, collect data, and I would treat anywhere from 6 to 8 people a month doing nothing but LSVT Loud. And I fell in love with it. I fell in love with the science. I fell in love with, I think, speech therapy at that point, because I suddenly saw something that had such a dramatic positive impact on people's lives that it was hard to walk away from, which I never did. So I continued on, finished my PhD at the U of A, have always done LSVT Loud, as Anissa mentioned, the expansion to other populations, to LSVT Big. And then the company really was a mechanism to help get the training out into the world. And so it's one thing to do the science and write the articles, it's another thing to translate that into clinical practice. And we're very passionate about doing that, and doing that in a manner that maintains the fidelity of the treatment. So the treatment that we deliver to the research subjects is the same quality that people can have in daily living. So that's a little bit of my story. Angela, I'll toss it over to you.
Great, thank you. Very excited to be here with all of you and to get your voices revved up here in a bit throughout the presentation. And thank you for the PMD Alliance for all your great programming for these. So a little bit about my story. I started working with mainly in hospital, neurological rehab centers, and was working with a group of people with Parkinson's. Looking around, there were not effective therapies. And I was frustrated by that. So I started researching what was available and learned about LSVT. And I became trained and certified in LSVT. And I remember sitting there as a therapist being so excited to go back to my patients on Monday with something that was effective. And as a speech therapist, we're constantly asked, how do you know this is going to work? Well, with LSVT, the other thing that was exciting is I knew it had all of this research behind it. So I could with confidence say, this is why and how it works. As a therapist doing the treatment then, it also became exciting to see how empowered the people I worked with became as a part of the treatment. People started engaging in conversation settings that they hadn't been doing in a long time. And as speech therapists, we have what we call these goosebump moments when your patients come back to you and tell you this amazing story of, I went to this dinner party, I used my loud voice, I was heard and understood, and you get goosebumps because you're excited for your patient. I got more of those with LSVT than other treatments that I did. So that's all I do now. Been a part of the research team since 2000, and I've been one of the training faculty to go train other speech therapists nationally and internationally. And I love to see the awareness in their face when they're thinking, oh, I can now take this to use with my patients. And then in 2012, at the end of the last randomized controlled trial, I became Chief Clinical Officer for LSVT Global. I still have a private practice that I do in addition to that, and leading Loud for Life classes, which we'll touch on a bit as well. So that's a bit about me.
All right, ladies, did you want to go ahead and share a screen and get started?
Yes, let's do that. So it'll give me just a moment and I will get, which screen is it sharing? Just a moment here.
It's sharing your desk. Oh, there you go.
Okay, that should be the full slide now. Is that correct?
It's perfect. Yep.
Okay, great. So as Angela said, we are going to talk about LSVT Loud. I'm going to give a short sort of content overview, and then Angela's going to take over and we're going to dig in and do some exercises together. And as she mentioned, really, I think what excites us as therapists, as scientists, is the ability to really empower people with communication, to live louder, of course, and better lives with Parkinson's disease. And we know communication is the heart of who we are as humans, our ability to connect and interact through the ability to communicate. You've learned about us already, so we can skip right on over that. Our plan is to give a very brief background on LSVT Loud. I'll introduce the LSVT Loud key concepts and a summary of the protocol. Then we're going to turn off the slides, do our interactive demonstration, and then we'll come back for a wrap up with a little bit more details on how you can learn more and perhaps find an LSVT certified clinician near you. And then we'll leave a good chunk of time, about 15-20 minutes at the end, for questions. We always share this just out of courtesy because we'll be seeing each other, to not take audio or video of the recording. This presentation is recorded by PMD Alliance to share in the future. And if we learn a little bit about each other, to keep that information confidential as well. Our mission at LSVT Global is to empower people with Parkinson's to restore and maintain their highest level of functional communication, mobility, and independence through scientifically supported therapy programs. And as we've learned, LSVT Loud is our speech therapy protocol. LSVT Big is our partner protocol that's delivered by physical and occupational therapists. But LSVT Loud, the speech treatment, is what we'll focus on today. So to begin, let's take a look at a video of somebody who's had LSVT. This is Shirley. You may have seen her before. We still love to share her because there's always people in the audience who are seeing her for the first time, and she brings such joy and really, I think, captures the essence of what behavioral speech therapy can accomplish. So she was 59 years old at the time I treated her, and 2.5 years post-diagnosis. She had noticed changes in her speech and voice, which is why she was seeking treatment. She is on her medications in the pre and post segments. So the changes that we see were really related to the treatment, which was 1 month of intensive speech therapy. So this is Shirley. You may be seeing her as a repeat or seeing her for the first time.
Have you noticed any changes in your speech or your voice that you would associate with Parkinson's?
Yes, I don't speak loud enough a lot of times.
Anything else?
Hoarse.
Anything else?
I stutter, which I never did before.
Do this for me if you would. Take a deep breath and say ah for as long as you can. Good for you. Okay. Would you say Parkinson's disease has caused you to talk less?
Yes.
Because?
Because I stutter and then I can't be heard. If there's noise in the house, like when the kids come over, nobody pays attention to it because they can't hear me. Till I get mad and then yell.
Take a deep breath and say ah for as long as you can. Have you noticed changes in your speech or your voice as a result of the speech therapy?
Oh, yes.
What have you noticed?
I talk louder. I think louder. I'm going to sing with the Sons of the Pioneers one of these days with my voice.
Good for you. That's excellent. Has anyone commented that it's easier to understand you now?
Oh, yes. I set some of our friends back when we went to their house and I talked loud. Lou says, "What the hell happened to you?" My daughter said, "Oh, Ma, that's you?"
So what do you do when you want to be as easy to understand as possible?
Think loud.
Have you noticed any?
Okay, so we love Shirley. What you could probably hear in her voice before treatment was softness, a little bit of a hoarse voice quality. She had reduced facial expression, and she talked about disengaging and feeling ignored. After treatment, where the treatment really focuses on improving healthy vocal loudness, we see that yes, her voice is louder, but her voice is clearer, her articulation is better, that improvement in facial expression, and really the engagement. And her fun personality that was always there, but was a bit masked by Parkinson's disease, was really able to shine. And I think that's something that we see in many patients. So with Parkinson's disease, over 89% of people with Parkinson's disease worldwide will have changes in speech and voice. It's very common. The most common changes are the voice gets softer and mono loudness, as well as monotone. So a lot of this pitch inflection is reduced. The voice can get hoarse, harsh, or breathy, and imprecise articulation. And so the question is, well, hey, does that matter? And of course we know it does. The consequences, as Shirley expressed, can be excluded from conversations, which ultimately can lead to a loss of dignity and feelings of misery for many, not being able to communicate, engage, and interact. Our work has been led by Dr. Lorraine Ramig, and there has been a 30-plus year journey from when the treatment was first developed by Dr. Ramig and her colleague at the Lee Silverman Center for Parkinson's disease in Scottsdale, Arizona. And that is why the treatment is named LSVT. That stands for Lee Silverman Voice Treatment. It was named in honor of one of the very first patients who received the treatment. Over the course of these years, in this middle section really has been our core science funded by the National Institutes of Health. We have 3 randomized controlled trials, which you hear a lot about in the news media today. These are sort of the gold star standard for really establishing evidence that a treatment or a therapy is effective. And in more recent years, a lot of time has been spent on clinical implementation. How do we get this research into the hands of clinicians and people living with Parkinson's disease? Beyond these 3 randomized controlled studies, we also have numerous studies, well over 30, examining other things that change, such as facial expression, articulation, what does the listener perceive, what happens to voice quality, what happens to the respiratory system, to the vocal folds, to swallowing, and even neural imaging studies. So we go beyond showing just does it work. We want to understand how does it work so that in the future we can hopefully even make it work better. So there's no other speech treatment that has this expansive, solid scientific foundation for understanding that it works, that it lasts over time, and how it works. The key concepts are these 3. Target of treatment is amplitude. We focus on vocal loudness. The mode of delivery is intensive and high effort. And we address this concept of calibration, which deals with problems with generalization outside of the treatment room. Also, this treatment incorporates principles of neuroplasticity, the ability to change the brain, and is designed and administered in a manner that's intensive to really challenge the impaired system to make it better. So when we think to this target of amplitude, what happens with Parkinson's pre-treatment, there's this loss of motor energy. So movements are underscaled. This happens in the body, but it happens in speech. You may not be taking a big enough breath. The vocal cords may not close all the way. The mouth doesn't open all the way. And what comes out is soft, reduced speech that's more difficult to understand. With this one simple cue of loud, we want to override that bradykinesia or hypokinesia, reduced amplitude, to produce healthy, normal vocal loudness. With that one cue of loud, we can increase drive to the brain, increase respiratory support, vocal fold closure, mouth opening, and what comes out is more normal, easier to understand speech. The key here is that it's healthy, and this is why a speech therapist is essential in the process to teach you a good way to improve vocal loudness. Also, that what feels loud to you is perceived by the world as normal. The treatment is intensive, and this is essential. 4 consecutive days a week for 4 consecutive weeks, so you get 16 one-hour individual treatment sessions in 1 month's time. You have daily homework practice all 30 days of the month, daily carryover exercises all 30 days a month, and our goal is to develop a lifelong habit of practice. When you're with the speech therapist, you're working hard as well, so this really is exercise of the speech mechanism. But that's not enough, because we can work with you in the therapy room. You'll get louder. It sounds great to us, but to you with Parkinson's disease, often you'll have this feeling, as this lady's expressing here, I feel like I'm shouting. This is too loud. This is not normal. And what we know is that people with Parkinson's have soft speech, but they often think it's within normal limits. And you may feel this way. I think my friends need a hearing aid. My partner, they don't hear me because it's their hearing. And while that may be true, the likelihood is that your voice also has gotten soft. You just don't perceive that. Once we get you up to a more normal level, oftentimes to you, it feels like you're shouting or talking too loud. So in therapy, the intensive training and practice also helps you get comfortable with this new sensation so that you're able to take that out in the real world and use it effectively. So in terms of a treatment session, we'll practice these in just a moment. It's 1 hour. The first half are spent on these daily exercises, long ahs like you heard Shirley do, and some other exercises, high-low ahs and functional phrases that Angela will walk you through. But the second 30 minutes of the session is spent taking that sort of voice that we've revved up in the first half and systematically training it into speech. So across the 4 weeks, we increase length of utterance from words to phrases to sentences to reading to conversation. And we do exercises that are meaningful and salient to you. So we talk about things that you're interested in. We work on goals that you want to improve. So even though we have this structured protocol that's been validated by science, we can still individualize the treatment to your needs. So our goal is that we use these exercises, the etc. That's not the goal of treatment. The goal is we train that voice into conversation that you can use daily. And we oftentimes say, you know, if you don't feel like you're talking too loud, you're not loud enough. And this is why. People with Parkinson's disease and before Parkinson's, you go to speak, out comes normal loudness. We don't have to think about it. If we want to talk loud, we put in 1 step of effort. If we want to shout, we put in 2 steps of effort, and we can feel and hear that difference. Well, now, as a result of Parkinson's disease, your voice may have gotten soft. In some cases, it may have gotten very soft. So if you're soft, you need to put in 1 step of effort just to get to normal loudness. If you're very soft, you need to put in 2 steps of effort just to get to normal loudness. So we oftentimes say, when people say to us, oh, I feel too loud, we say, remember, you were soft. So when you feel loud, what's coming out? Normal loudness level. All right, so that was a very high level sort of introduction and overview, but now let's put that to practice, and I'm going to turn it stop sharing my screen here, turn it over to Angela so that we can give these exercises a try.
Excellent, great. All right, so if you, hopefully you have a little bit of water handy. You might need that as we get ready for the practicing. One of the things you'll learn with LSVT is that hydration is very important. So we're going to dig in, just going through, giving you a little snippet of what these exercises would be like. We're just doing a few samples. Keep in mind this would actually be an hour treatment session if you were doing this with the therapist, and the therapist would be listening to you and providing you with very specific feedback about your voice and things to do to produce this in a healthy way. This just gives you an overview. The first exercise that we do every treatment session are the sustained phonation or the So the way that this is going to work today for our practice session, we're going to do about 6 of these. I am going to count for 15 seconds on my fingers. Some people may be able to hold the ah for 5 seconds. That's okay. Some people may be able to hold the ah for 30 seconds. It's not a competition. This is very individual. As you are doing the ah, we want you to do it with increased loudness, and in a way that doesn't feel tight or strained. If you run out of air, and I'm still doing the 15 seconds, just stop, get ready, go again, all right? What we don't want is anyone doing ah to the bitter end. So if you start to run out, just ah, and keep it going. So here we go for ah number 1. I want you all thinking loud. 1, 2, 3. You all keep it going. Keep it loud. Keep it going, keep it going, keep it loud. If you run out of air, catch your breath, go again, and stop. Great. All right. So as you go through, you should be feeling some increased effort. Remember, as Cynthia said, we're not just doing ah to do ah, but this is the voice we want you to use when you talk. All right, here we go for ah number 2. 1, 2, 3. Keep it going, nice and loud. Keep it there. Good and loud. All right, I see some good ahs happening. Excellent. If you have some water, go ahead, take a little sip. Keep that hydration going. As you're thinking about this, feel this effort. It's what I want you to use when you talk to someone after this session. We're going to get ready for ah number 3. Here we go. 1, 2, 3. Keep that good loudness as you hold it out. Nice loud voices. Good. Keep it there. Excellent. Good. Okay, so you can see we're keeping up that intensity that Cynthia talked about. This is a part of therapy. So we want that intensity to make change. So we're going to do ah number 4 now. Here we go. 1, 2, 3. Keep that voice going. Good, nice and loud. Good, I'm seeing some nice ahs happening. Super. All right, when you're in therapy, a part of that saliency, making the treatment activities important and salient and personal to you, would be to find out things that you like to do. So let's say all of you like to go for walks or hiking. As you would go through therapy, your therapist would start to add some dual tasks, so you get challenged in keeping the loud voice while you're moving. So for this next one, what we're going to do, still seated, is like you're doing some big movement while you're walking and doing that off. So I'll show you first. It's going to look like this. That's what you're going to do. All right. Don't let that voice drop down. Here we go. 1, 2, 3. You keep it going, nice and loud. Don't let that voice drop down. Keep the going. Almost there. And stop. Woo, good. All right, you should be feeling like you're getting a bit of a workout now, keeping that voice going. We're gonna do one more just like that. So when you're ready, 1, 2, 3. Keep that voice going. Good. As if you were walking and talking loud. Keep it going, keep it going. I like it. And finish. Woo! All right, I think you all need a little sip of water after that. Excellent. So the idea in therapy is we continue to challenge. If people can get that loud voice, then we add some challenges, either with movement or additional things you're thinking about. In therapy, you would do a minimum of 15 of those. We just did 6 for today. We're gonna now go on to the next exercise you would do every day in therapy, which are the highs and the lows. Now, a lot of my patients will say, I've never been a singer. I don't want to do these singing exercises. This isn't a singing exercise. It's a stretch because in Parkinson's disease, the voice can become monotone. So we're working to get more inflection into your speech through these exercises. I'll show you first what I want you to do, and then I'm going to have you do what I do. So I'll do one first. You can just listen. So you saw I started with my voice, and then I'm going to try to go up in pitch. So I'm going to have you do that same thing. Only go as high as you can with no strain. So what we don't want is no, we don't want that tight strain. Only as high as you can go with no strain. Keep it loud. Here we go. 1, 2, 3. Super. Okay, so make sure you're starting with that good strong we practiced first, and you're keeping it loud. So here we go for number 2, nice and loud. 1, 2, 3. You keep it going. Keep it loud. Good. These we don't have to hold as long because we're getting that stretch. At any time, if you need a sip of water, pause and get a sip. I'm going to get another one here. Okay, so we're going to do number 3 for the highs, starting with that good, strong voice. Here we go. 1, 2, 3. Keep it loud. Great. So again, if we were going to add some dual tasks in therapy, let's add one thinking of that you need to reach something high on a shelf and pull it down. We want to keep that same loudness. So I'll do it first. I'll show you what it's going to look like. And then I'm going to pull down what I was getting off that shelf. All right, so keep that same loudness. Here we go. 1, 2, 3. Reach, you got it, and pull it down. Good. All right. So now we're going to do the other arm, reaching for something high. Keep that loudness. 1, 2, 3. Pull it down. Good. Now for the last one, it's something really heavy this time. So we're going to use both arms as we reach. So good loudness. Here we go. 1, 2, 3. And pull it down. Nice. All right, take another sip. And then we're going to go to the lows. So we're stretching. We stretched high. Now we're going to stretch low. I'll do one first. Listen, we're going to start with that strong ah. Ah. Okay, only going as low as you can, keeping it loud. So here we go, nice and loud. 1, 2, 3. Keep it loud, keep it loud. Super. All right, so you're doing that nice stretch down. Here we go for the next one. Start with your strong ah. 1, 2, 3. Ah. Good. All right. See if you on this next one can go any lower, still keeping that loudness. Here we go. 1, 2, 3. Super. All right, take a little sip of water, and we've got 3 more of these. Again, in therapy, your therapist would have you do a minimum of 15 of the highs and a minimum of the 15 of these lows. This is just giving you a sample. So here we go. 1, 2, 3. All right, for the last 2, we're going to add a movement. I'm going to have you count it out with me. All right, so doing just what I did, keeping that voice loud. So using your fingers to count it out. Here we go. 1, 2, 3. Good. So really getting that amplitude, even to those fingers with those big movements. Here we go for the last one. 1, 2, 3. Nice. All right. So take another little sip, and we're going to get ready for the next exercise you would do daily. And for this one, I don't know, do we want to pull up the slide, Cynthia, or just have me say it and they repeat?
That might be faster.
Okay, I'll just say it and you repeat. So in therapy, your therapist would have you come up with 10 things that you say every single day. And the idea is then you practice those over and over in therapy in your loud voice. They become so ingrained in your brain that when you say it in your daily life, it reminds you, oh yes, I need to be loud. That's my loud voice. So I'm going to give you some common phrases now, but remember, if you were doing this in therapy, you would have your own phrases you would come up with. So I'm going to say the phrase, so when I go like this, I want you to repeat it using that same good ah voice, that same loudness we just practiced. So feel that same effort. Here we go. Number 1, how are you? Okay, you should be feeling that same good loudness. Do you want some coffee? Okay, keep it loud. I love you. Good. What's for dinner? Okay, don't let the loudness drop down. Make sure you're keeping it revved up. Let's go for a walk. Nice, feel that ah voice. It's a beautiful day. Super. Let's go. Okay, keep those voices going. We have 3 more. Feel that same loudness. Have you seen my phone? Okay, good. What's on TV tonight? And with gusto, last one, time for bed. Okay, so you get the idea. You would practice these. These would be your own phrases of things you say every day. And then it helps you to remember to be loud throughout the day as you happen to say those. As Cynthia explained, the second half of every hour that you do in therapy for LSVT is reading and conversation. And again, this is going to be based on things that are personal and interesting to you. This isn't just some standardized workbook list. That doesn't translate into your daily life, but we would find out what are your hobbies, what are your interests, and that's what we would read and talk about, because that will translate into your daily life. For purposes of this today, we're just going to do a little responsive where you need to think loud, but you need to think a little bit more about your response. So the challenge is, as you're thinking of what I'm going to ask you, keep that same loudness. So let's say maybe you were really interested in world geography. So an activity is, I am going to say the name of a city, and when I do this, I'm going to have you say the name of the country. So I'll give you an example first. If I were to say Beijing, you would all say China, okay? And you want to make sure if I say Beijing that you're responding China and not China. We want that same good loud voice coming across while you're thinking of these answers. So here we go. Ready? Nice and loud. Paris. Okay, good. Keep up that loudness. London. Good. Seeing lots of good responses. Dublin. Make sure you're feeling that same ah voice, nice and loud. Moscow. Good. We're going to do about 3 more here, keeping up that good ah loudness. Rio de Janeiro. Nice, good. Athens. Super. And last one with that good loud voice, Rome. Good. All right. So that just gives you a small sample of what might happen in your treatment session. But I think we're going to go back to a few slides now to just wrap up this part, and then we're going to open it up for some question and answer from you. All right, perfect. So some of you may be thinking, this is interesting, I'd like to learn more about how I could get this LSVT Loud therapy. We are always available to answer any questions you might have, but you can also go to our website and you'll see the arrow here pointing to find LSVT clinicians. There's a big orange button there. If you click on that button, it will bring up a page where you can type in your zip code, and it will bring up the LSVT Loud speech therapists that are near you. Or if you're interested in LSVT Big, the physical occupational therapy, those therapists will show up as well. If for some reason you don't find people near you, always contact us. We have other access to other therapists and we can help you. And depending on your insurance, most insurance might require a prescription from your doctor for speech therapy evaluation and treatment. Next slide. So some questions to ask. If you find, say, there are 10 therapists near you and you're trying to figure out the best one for you, you interview them. Who's the best fit for you? So ask them, do you deliver the gold standard dosage of LSVT Loud? As you learned, that's 4 days a week for 4 weeks, individual 60-minute sessions, and then you're going to do the daily homework and carry over. Ask them how many people they've treated and what have their outcomes been with those individuals. Are they similar to the published research? And then do they have a follow-up or maintenance plan for their clients? We mentioned briefly this Loud for Life, and this is something that individual therapists offer. We as LSVT Global also offer a televersion of this, and they're weekly classes for people to meet together after they finish the therapy to practice together to maintain their voice in a fun environment. Next slide. We also on our website have a wealth of educational opportunities available for you as well. We offer monthly live webinars that are all then recorded on demand on a variety of topics, really based on feedback we get from people with Parkinson's of things they would like to learn more about. You can also see more pre-post videos on the website if you're interested in those, read some testimonials. And we're always here to answer any questions that you might have. I did see a question pop up at the very beginning about using masks in this day and age. And yes, it can make communication more challenging. We have this handout that is available to you. You'll get a copy of these slides. This is also available on our blog if you're interested there. But a couple of tips for you. One is, you saw that diagram Cynthia showed you of increasing your loudness. What I find with people that I work with is when they're wearing a mask, they may even need to bump that effort up 1 or 2 more steps than they do without the mask as well. Speaking slower or in shorter phrases can be helpful. Looking directly at the people that you're talking to can also help increase that. And giving a little heads up, telling the listener what the topic is going to be about first. So a little teaser to that topic. Asking some of these yes/no clarifying questions as needed. Trying to get in an environment where there's not as much background noise. Turn off the TV, or if you're in a noisy outside setting, maybe trying to find a place that's a little quieter. Some people might have personal amplification devices. You can use those as well that would go over the outside with the mask. There are a few of those clear mask options available, again, on our blog website, and I saw that the information was put in there too. We can give you more information about that. Using gesturing to convey your messages can help a lot as well. So these are just some tips for everyone in general, and then you can reference this to see if any of these are helpful for you. So we'll go on to that next slide. And Cynthia and I love this quote as speech therapists. As speech therapists, we're probably a bit biased about the power of communication, but I think this can't be said any better. If my possessions were taken from me with one exception, I would choose to keep the power of communication, for by it, I would soon regain all the rest. So we've enjoyed this time with you, and now let's open it up to your questions.
Thank you, ladies. That was awesome. I enjoyed the practice. It was fun. Although I had a smoothie next to me instead of water, and that's doesn't do well for your voice. So we do actually have a few questions, and you may have seen some of them in the chat. But to go up to the top, someone had asked, what's next for LSVT Loud? Is there any new research affecting how you train your speech therapist, or what you train them, and how you work with the PWPs? You guys are the gold standard, but curious if you will keep doing the same as what you have been, or if your trainings have evolved or will evolve.
Yeah, I'll take a first pass at this one. Absolutely, it's been very exciting. Actually, 2020 has been a very active year for research. There have been, I believe, 8 new publications already this year, specifically on LSVT Loud. One of them from our laboratory was looking at the impact on speech intelligibility. So we know loudness makes you louder, but really understanding, looking at LSVT Loud compared to a treatment that worked on speech articulation in particular, matched for intensity. And really what we saw, that it seems that there's something special about loudness and its ability to really drive these global changes. So our research continues on. We've not stopped. We have a pile of papers in the hopper. And what's exciting is that research is coming from labs all around the world. So looking at cross-linguistic effects, use of LSVT and other disorders, looking at patient-reported outcomes, how do people with Parkinson's feel after the treatment. Other things that we're really hot on are using technology to increase accessibility. And so developing both telepractice platforms, independent software platforms, and things like that, so we can get more treatment to more people with Parkinson's disease, and further developing our continuum of care. As we mentioned, you can't do 16 sessions and stop. It's ongoing, and how do we engage people? Some people like to come together in group practices for Loud for Life. We're moving a lot of those to virtual. We're working on connecting people from around the globe, and so our mission is always, how can we do more? How can we do it better? So we won't stop and get stagnant. With that, I know a couple questions came in about telepractice. So that is something we do. And Angela, I'll let you follow up and talk about how LSVT Loud can be delivered via telepractice.
Yes, it's very effective via telepractice. And in my private practice, that's what I've been doing since COVID. The nice thing, though, is this isn't something new with COVID. LSVT Loud delivered via telepractice has been around for years and years and years. And in fact, there's some really nice research that supports the evidence of delivering it in this way, getting outcomes that are similar to the face-to-face. So unlike some other speech therapies who are just now trying this, this has been done this way for quite some time. If you're interested in getting it via telepractice, when you do that clinician search, their LSVT Loud via telepractice is called eLoud. And so therapists who have taken a special additional course for the ins and outs and logistics of doing that will also have that eLoud provider by them. I really like doing the telepractice. What I see from my clients is it decreases some of that burden for them of having to travel to get to the appointment. I like that we're surrounded by their personal environment. So if I have someone interested in art, they can tell me about the painting on the wall behind them instead of having to bring stuff into the treatment room. I had a gentleman who did a tour of his house that he had just remodeled to show me. So it can really provide some nice additional opportunities for that salient practice as well. You would need to check with your individual insurance about coverage with telepractice in general, not just LSVT, but through COVID, Medicare has been covering that as well. I don't know if you had anything additional to add there, Cynthia.
I think that's good. I think that's good. Yeah.
So I know you kind of touched on the telehealth aspect, which was before COVID, and it certainly has bumped up with COVID. And then you talked a lot at that point about the use of mask and communicating with the mask. So there was a question that came in about just the reduction of talking and the impact that that has. So if we're not getting out, we're not socializing, and maybe people live alone. What's the impact of not speaking as much? And does that cause you to lose your voice?
Anything, you can go to that plasticity principle of use it or lose it. And so if we're not using it, we are at risk for losing it. And so it is a challenge now, not getting out as much, not seeing people, many as opportunities for practice. But I think there's some ways that we encourage people to keep practicing as much as possible, reaching out through Zoom, doing the phone calls, perhaps calling people maybe you haven't reached out to in some time and getting that voice practicing. Talking to, if you have animals, I know I have conversations all day with my animals, especially when I was working at home. I just got back into the office on Monday, but you know, who do you talk to? Also, you know, our devices and the idea of Alexa and Siri and Google, can they understand me? Can I do some practice? Can I pick up the magazine or newspaper that I'm reading and read it aloud for a while, for 5, 10, 15 minutes a day, or, you know, for 3 minutes of every hour? So even if it's not direct communicative impact, you can still exercise your voice, hopefully to help keep it strong and even in these difficult times.
So there was a question that came in that makes me curious too. So is there ever a point where there's not enough voice left to work with? So someone wrote in that, you know, they can hold their abs or maybe their voice for 5 seconds, but they can't say phrases. So 99% of the time they can't speak at all, except very softly. And they were told in voice therapy that they didn't have enough voice. Is that a thing? And is there any recommendations?
Angela, you want to take that one?
Sure. Yes. So, you know, we are big advocates, of early intervention, get in early to get the voice and speech strong, but also big advocates of never saying it's too late. So, you know, of course, without doing an evaluation with this person and speaking one-on-one, I'm just making a generalization here. But in general, with individuals who are, you know, have more severe voice and speech issues, we do see that LSVT can make an impact. Is it sometimes to that same level of I'm having hour-long conversations and keeping my voice loud? Maybe not. But could it be to the point of I have these phrases that I can say and be heard and understood? Certainly. A lot of what is being described here sounds like from having some more intensive training, getting that motor speech system stronger to see what could the impact with that first be. And that would be a first place to start. So I'm not sure if this person's gone through intensive 4 times a week for 4 weeks therapy. You know, if someone's only doing 1 time a week, you're not getting enough of that motor practice to really see what is the potential for this person. And I know Cynthia and I both had people we've worked with who, you know, maybe come in our office initially and we're thinking, oh, I'm not sure. And then you just have these magical moments of this voice coming out with great potential.
Mm-hmm.
And if, you know, someone does say maybe even have like an atypical form of Parkinson's where their speech might be a little more impaired than expected, even if they don't respond as their expectations are, maybe with loud, as speech therapists, are there things that you can offer in terms of other communication tools that might be of benefit?
Absolutely, absolutely. So we look at communication as a whole. And so there might be strategies for manipulating the environment, again, reducing background noise, face-to-face, knowing what topic that we're talking about. There are definitely, you know, text to speech apps that can be helpful. So if you have longer things to say, being able to type or text it out, and then the device that you have will speak it for you. There's alternative augmentative communicative devices that take, you know, the text to speech is available for anyone. These are more communication devices that are developed specifically to help people who are having difficulties speaking orally to be able to have that out. There's also groups that do what we call voice banking. This can be done by anybody at any time, whether you have Parkinson's disease or not. And I'll get the link and be able to share it for anybody who has questions afterwards. This can do multiple things. One, it's a way to practice your voice. Vocal ID, and you can bank your voice. They can use that to build voices for other people. It can also be something that, let's say, 10, 15 years down the road, you need some kind of device to help communicate. If you've banked your voice years before, when they create that text-to-speech app, it can be your voice. It can be you that's speaking. So there's a lot that's potentially available out there. So we like to see what we can get from you and your own physiology first. And then if we need to add other bits and pieces on to give you the best communication possible, that's what your speech therapist will want to do.
Wow, voice banking, that's an incredible idea. I love that.
Yeah.
So there was another question that came in about breathing devices that help with breath support.
Yeah, there is expiratory muscle strength training, EMST, that has been shown to improve respiration. What we see, that training alone doesn't necessarily have the direct impact on vocal loudness. What we have seen with expiratory muscle strength training is improvements in things like cough, which is very important for safety of swallowing and protecting your airway. Also, I think some people may do some combined, we've not done a systematic study, but sometimes some combined therapies where maybe some combined expiratory muscle strength training along with voice therapy to give maximal output. Angela, what would you like to add to that about muscle strength training? Anything?
No, I think what you said is exactly what I would have said, to help with, you know, coughing, could that potentially help swallow, but we need some research on the actual impact of either the combination of LSVT with that, but we just don't have that information right now.
Right, and one person asked if they have a high tone that cuts out, sometimes squeaking, and is that something that LSVT would help?
So again, with some of these types of questions, we'll give general answers because everybody is different, but we certainly see that type of a characteristic that can happen with some of this vocal instability in Parkinson's disease. So all of the exercises that we do, so that sustained, it's designed to strengthen the muscles needed for voice, get the voice louder, but we also see increases in the stability of the voice over time with that exercise, because it trains the proper breathing with the voice together. Also, those highs and lows help to get more stability, more inflection into the speech. So with Parkinson's disease, there's definitely a direct effect, and we see this physiologically when an ear, nose, and throat doctor looks at the vocal folds that can happen with the vocal folds, and we see positive changes with the vocal folds over time. So it's a whole system, but also directly with the voice. So what I say to each person who has these individual, do you think this could help me, is if you go to a certified therapist, they're trained in how to do what we call stimulability testing. So part of their assessment would be taking you through some of the exercises to see, does it have an impact for you? Is this something that would be appropriate for you or not? But you don't know until you go and try it. So that would be my step one, is to try to get connected and see if you notice an impact through that stimulability testing.
Fantastic. Well, I think that's very helpful. So ladies, we are pretty much at the end of our time. Any final thoughts or words to our audience today?
Sure. Thank you, first of all, for joining us. Communication is so important, and I think the take-home message, there's a lot that can be done to improve communication. LSVT Loud is, as was mentioned, the gold standard, and finding a therapist, getting engaged. I just saw something pop on about, does insurance cover it? And for the most part, yes, including Medicare. It's always good to double check with your providers, but the resources are there, the treatment's there. Keep talking, keep communicating. The people who love you want to know what you have to say, and that's so important. Angela?
I couldn't have said that better. That was great. You have important things to say, and give the gift of what you have to say to your loved ones and those around you. So get that strong voice so they can hear and understand you.
Awesome. Well, thank you so much, ladies, for your time, your expertise, and running us through these exercises. Thank you, everyone, for joining us today. We hope you had fun. We look forward to seeing you in another program, and have a fantastic rest of your day. Bye, everyone.
Thank you.
Thank you.
Bye.